Some chronic pain travels. It moves up the leg or shifts around the lower back. But there is another kind of chronic pain that settles into one specific spot and refuses to leave. A foot that shifts color. After an injury, a groin area that burns constantly after a surgery. Patients with this highly localized pain usually face a frustrating loop. The original injury heals. The MRI shows nothing structurally wrong, and the medications that work for other types of pain barely make a dent. When imaging shows a healthy spine, it's because this pain is driven by a localized neurological misfire that standard scans simply cannot see. If you have spent years being told your pain is out of proportion or that it is all in your head, you need to hear this. You are not imagining it. There is a recognized clinical diagnosis for what you are experiencing. It is often called complex regional pain syndrome, CRPS, or focal nerve pain. It typically starts with a clear physical event, a broken wrist, an ankle sprain, a minor operation. The physical tissues repair themselves, but the nervous system in that exact area overreacts, trapping the limb in a constant, disproportionate loop of pain. This specific neurological condition requires a highly targeted approach, rather than generalized treatments that affect the whole body. The source of this trapped pain sits right outside your spinal cord, in a small structure called the dorsal root ganglion, or DRG. Think of the DRG as a sensory mailroom. One handles signals from your foot, another handles your groin. When localized pain becomes chronic, its specific DRG gets stuck. Hypersensitive nerve cells constantly fire false alarms to the brain, with no actual trigger. To stop these false alarms, you have to go directly to that malfunctioning mailroom and quiet it down. DRG stimulation is an implantable therapy that delivers tiny electrical signals precisely to the one specific DRG causing the problem. Traditional spinal cord stimulation casts a broad net over the spinal cord, but DRG stimulation targets only the single affected node. These gentle electrical pulses interrupt chaotic signals, helping hypersensitive nerve cells settle, completely stopping the false alarm. Matching the precise anatomical footprint of the technology to the geographic footprint of the pain allows patients to finally put on a normal shoe, sit through a meal, and regain normal function. This chart shows the results of the landmark ACCURATE clinical trial. When researchers tested DRG stimulation against traditional spinal cord stimulation for complex regional pain syndrome in the lower limbs, 81% of DRG patients achieved meaningful pain relief at 3 months. Beyond clinical data, patients can test the therapy for 5 to 7 days during a temporary trial phase. During a brief outpatient procedure, a physician places temporary leads near the targeted DRG. You go home the very same day and spend the next week testing the therapy in your actual daily life. The standard benchmark for success is at least 50% pain reduction. If the therapy doesn't meet that goal, the temporary leads are simply removed in the office. The trial phase guarantees you receive undeniable, personalized proof that the therapy works for your body before you commit to a permanent system. This precision tool is reserved for focal pain. Patients with widespread moving pain, deep muscle aches, or structural spine issues requiring traditional surgery are usually better suited for different treatments. If you have stubborn nerve pain locked in one specific spot, it is time for a proper evaluation. At Vertrae in Dayton, Dr. Kamal personally evaluates every DRG candidate to determine the right path forward. Years of unexplainable localized pain deserve a precise, technological answer that addresses the source directly. Visit Vertrae.com to schedule your motion-first evaluation today.